Hello, my name is Lujain Mokli. I'm going to present this visual project which is about extraoral examination of patients with mandibular laterognatism. Starting with patient informations and chief complaint, 19 years old male patient reported to the Department of Orthodontic and Dentofacial Orthopedic for correction of his facial asymmetry since 6 years with chief complaint of masticatory insufficiency. No history of injury to his head. This picture illustrated the frontal view at rest, frontal view at smile, and profile view. Coming to extraoral analysis, with the frontal view at rest, facial form ovoid to tapered, facial symmetry asymmetric with chin shifted toward left side. Transverse fifth showed that lateral fifths are narrower than central and medial fifth, and the mouth it's not within the interpupillary distance, it's shifted toward the left side. The nose is slightly wider than the central fifth, and chin is out of central fifth, it's toward left side. And vertical third showed increased lower facial height. In a frontal view analysis at smile, the vertically incisors display adequate, gingival display is inadequate, smile arc is consonant, transverse, maxillary midline, it's not coincidence with facial midline, it's approximately 1 millimeter toward left side. Mandibular midline, it's not was visible, and occlusal plane can show roll deformity. In a profile analysis, with angle of facial convexity, it's normal. Within the normal or the mean value, it's 13 degree. In vertical analysis, the lower facial height is increased and length of the upper lip is proportioned with length of the lower lip. Nasolabial angle is obtuse, more than 110, it's 112. And the nasofacial angle is increased 40 degree, which is more than the normal value. Increased nasomental angle 135, and decreased mentocervical angle 100 degrees. The submental neck angle, it's more to right angle. Nowadays it's considered to be normal. Maxillomandibular prognatism, it's shows retrognathic maxilla and retrognathic mandible, as SN point is 2 millimeter anterior to the vertical line, and Bogonian point it's 6 millimeters behind the vertical line. E line shows retrusive upper lip, and lower lip is in normal position, which is on the line. Borestone line shows retrusive upper lip and lower lip within normal. S line shows upper lip is too flat. Nerve field Z angle, it's within normal, 72 degrees. Interlabial gap in the mean value is 2 plus or minus 2. It's within normal, 3 millimeters. Coming to the last part, which is a problem list, anteroposteriorly, vertically, and in transverse plane. Anteroposteriorly, skeletal, retrognathic maxilla and mandible. In soft tissues, retrusive upper lip, about 9 millimeters. Increased nasofacial angle, increased nasomental angle, and decreased mentocervical angle. Vertically, skeletal increase in lower facial height, and in dental, inadequate gingival display. Transverse and skeletal facial asymmetry, lateral fifths are narrower than central and medial fifth. Chin, it's out of central fifth, it's toward left side. In dental, a maxillary midline, it's not coincident with facial midline, and occlusal plane can show the roll deformity. That is the case before and after treatment, and the photographs of intraoral before and after treatment.